Good morning, everyone. I just want to echo thanks that Aaron already gave to Denisa and to Mindy and to Shakopee and the Healthy Foods, Healthy Lives Institute for hosting this conference, all the conference planners, and for allowing me to be here today to share the stage with so many wonderful people. I feel like I'm not going to be as funny as Aaron, and then I'm being followed by Chef Sean Sherman. So I'm kind of the intermission, but I'm going to do my best here to also get you excited about policy, but on a different level and scale, I think, from what Aaron was just talking about in the Native Farm Bill Coalition. And I first want to just give you a little bit of information about myself, in case, I've met so many wonderful people here, but I don't know everybody. So I am the director of the Healthy Eating Active Living programs at the Public Health Law Center. I have 3 kids who are all ages between 13 and 20, so quite a range. So good food is really important to me for their health and well-being. I am half Japanese. I grew up in Iowa, and I partially fulfilled my Japanese mother's dream by becoming a lawyer, but she sort of has a hard time understanding why I'm not doing corporate law, but she gets that this is my passion, and of course having 3 grandkids helps a lot. And I want to say, again, thank you to all the partners, too, who are in this room and elsewhere that I have learned so much from, the Great Lakes Intertribal Epicenter and their Good Health and Wellness in Indian Country program partners, many of whom are here today, the American Indian Cancer Foundation, National Indian Health Board, Missouri Breaks, IFAI, Denisa, and all the many tribal public health advocates who are here. I think over the past few days you've heard many great policy stories, and so I'm going to hope to add to what you've heard. I want to tell you a little bit about the Public Health Law Center in case you haven't heard about us before. We are a public health policy technical assistance center, and as Denisa mentioned, our work is founded on the principles that everyone deserves to be healthy, and so we work to support public health officials, advocates, researchers, and community groups in developing public health laws and policies that are grounded in community, good science, lived experience, and solid legal principles. Our offices are located here in Minnesota, just a little bit north and east of here in the St. Paul in the Mitchell Hamline School of Law, which is also in the Dakota land in the Bedote region, which is land that has been stewarded and protected by the Dakota peoples, the Anishinaabe peoples, and many other indigenous peoples from around the United States and the world. And we recognize that, like the land that our offices are on, the law comes with a lot of heavy legacy of oppression and cruelty, and so that we see as a law center, we see it as part of our job to apply ourselves in supporting tribal nations and exercising their sovereignty to improve the lives of their community members. And for this reason, this commitment is part of the reason I'm here today and really honored to be here today. We focus on the public health laws and policies, issue areas that you see kind of on the buttons on this screen, that I'll kind of blow them up a little bit. So it's access to healthy, affordable, culturally relevant foods, being free of the harms of commercial tobacco use, and then also having opportunities for safe, culturally and appropriate ways to be physically active. Now, I know we just heard from Aaron about how important it is to be thinking about what Congress is doing and federal policy and the trust responsibility. And so I'm going to be talking, though, about policy from the angle of more of the level of tribal policy, the policy sort of that is going on around in the communities around us and that maybe you feel are seeing more directly and impactfully. And for this reason, because you're seeing, people see oh, they think of healthy food policy, it's like, ugh, I don't want to be told what to eat. I don't want to be told what to do. I want to make my own choices, that kind of thing. Sometimes policy can feel like a dirty word to people, but I try to encourage people to think about policy as being an opportunity too. I mean, yes, it can have those sort of negative side connotations, but it also, as we've heard from stories yesterday and in previous conferences, that policy can actually open doors, create opportunities for us to live healthier lives. And so I try to think of it as like this path, that it is something that guides a good policy is something that guides our steps, guides our ways of living in a way that we maybe aren't really as aware of, so that we taking us to a good place, a better place, again, without making us feel like we're being forced to go somewhere. Now, I think many of you in this room are doing work in this area, maybe, you know about it, and maybe you don't even, but I thought it'd be helpful to just talk a little bit about some of the terminology that we use, particularly when we're in the kind of world of public health, because I know like the Good Health and Wellness in Indian Country program funds a lot of work, and then there's other state programs and other entities that do this, and they use this kind of lingo. So I thought it'd be good to talk about it a little bit. So policy, here's how we talk about policy in this work, that it is guiding principles, it can be guidelines, but also can be things like laws, rules, organizational policies, things that are written down that provide direction again for how we live. But also in some communities, it can also exist as unwritten policies or and things like customs or practices. So that's an important part of policy too. And then systems are the ways that a community or organization operates within itself, or the processes that it uses to do its work or to function. And then environment is the world around us, and it can be the physical world. So actually, like, are there good trails to walk on? Are there stores that we can go to? Are there places we can get food? To also the social and kind of cultural and economic environment around us. And these we talk about these things as separate things, but they also really exist together, and they work together and are very interrelated. And so I've been trying to think over the years how to diagram this, and right now this is kind of what I have, but it's not just one separate thing. They all kind of function together. So if you think about Chef Kay-Ann Miller's story yesterday about the work that they've done with the Montana State food system there, that is a great example. She talked about how they started with a piece of paper that talked about the university's value on serving indigenous foods on campus, and that led to systems changes, the development of new menus, where foods are purchased from, how foods are purchased, the growing of indigenous plants and produce on the campus itself, and then even the having music, in the cafeteria, as well as the menu design. I don't know if you remember seeing, she had a screenshot of the menus, but even the menus, the design reflected indigenous cultures. And then working through the process of getting the whole campus certified as a source of produce. So that was a great example of how all those policy systems and environmental components can work together. Now I'm just going to quickly just put this up here. Again, many of you will know this already, but I find it's often helpful just to kind of show people like where all the many places that tribal law and tribal legal authority sits in a tribal community. So it's things ranging from treaties, constitutions, to the decisions that tribal judges issue, to compact agreements, and then customary law. And then here's where I think many of your work and the work of like folks like Denisa and advocates who are working on tribal food systems comes into play, with executive orders from tribal presidents or councils, resolutions, ordinances, codes, and then regulations issued by tribal agencies. And so these are all the places that you can impact with your work on healthy food policy. And then I like to reflect for a moment on where you can find examples of policy systems and environmental work across and within a community. And I use this graphic and want to give a shout out to the American Indian Cancer Foundation, who have been sponsoring the wonderful wellness room here for the conference. They're an incredibly important partner, and they do so much work on policy too. And they've created this graphic, which you may have seen before, and if you haven't, I saw they were handing it out. There was available as a handout, so it's a wonderful poster too, that provides a great visual for this. And so you can see in this, and it may be a little bit hard to read on the screen, but it shows the many places that nutrition policy can be found across a community through tribal code, and also through just organizational policies or departmental policies and programs, because all of those types of entities are going to have their own policies that can also be impacted. And then, again, we've heard a lot throughout the days of this conference, as well as Aaron was talking about the many programs at the federal level that the Native Farm Bill is addressing to give tribal parity and get more tribal 638 authority for, and a lot of those are programs. And so I think it's important to acknowledge too that programs play a really important part in this work. and that it isn't just policy, but it also needs to be policy and programs working together. And so I think especially for people who are really grounded in public health, we're very comfortable thinking about programs and how we do things programmatically, and sometimes making that shift to policy can be a little bit uncomfortable. And so I think it's helpful to think about all the ways that these two components, programs and policy, or PSE, work together. And so I say programs need to be strong because they build an effective basis for policy change. They help build that community buy-in, that community support. They help educate people, that help educate policymakers about the issues and the needs. And then at the same time, policies can also help bring long-term sustainability to these program efforts. So like much of the work, like we're talking about funding the FDIPR or working with the SNAP program, I mean, and putting these into policy means that these programs are going to continue for a long time and continue to be good partners for that policy work. And because programs tend to be voluntary and are more focusing on providing needed services, they're really good for kind of wearing down people's resistance to sort of new ideas, and again, helping people get acclimated and understand, like, oh, so like eating good food doesn't mean I have to eat things that I don't like, or that I, don't get to enjoy my food anymore. But they get experience through these programs of saying, oh, like this actually, I actually feel better. It actually, there's many things that are tasty, and maybe there's ways that I can do this more affordably and more feasibly for my life. So programs can help build that kind of understanding and support. So like here is another visualization graphic to show how programmatic efforts and policy efforts can go hand in hand. And this is actually something I want to give we saw her on stage yesterday, Shiloh Maples. When she was at the American Indian Family and Health Services clinic in Detroit, and part of a Good Health and Wellness in Indian Country group that we were working with, we worked together with her to develop this graphic or visualization to show what an organizational food system can look like and how it can build off some different components to support, again, nutrition, good policy, as well as programmatic efforts. So the clinic had a garden, a community garden that could be, and they also hosted an on-site farmers market. They had an agreement with an entity there in Detroit to host a farmers market there for community members there who came onto the clinic. And they also were running a fresh prescription program, a fresh produce program, so where somebody, if they get screened and for either food insecurity and or some kind of a health condition like maybe prediabetes or diabetes or hypertension, they can get a prescription or a coupon or a voucher so that they can go to, in this case, the farm stand, sometimes it's a grocery store, to redeem that for fresh produce. And so it's a way, again, of kind of helping people stretch their budget, but also introducing them, giving them a way to get introduced to new, healthier foods, and also encouraging them to try them. And they also had a kitchen where they did some classes and were showing people how to make some things from the produce in the garden or the farmer's market, and they were working towards wanting to get a license, so it could be a community kitchen. Again, that would be a policy thing, having a licensed community kitchen so that community members could come in and make things for themselves, like for a cottage food kind of business, or they could have, again, cooking classes there. And all of these things would work together then to support that kind of whole package for healthy eating and better nutrition. And then this is another example of how policy and programs work together. So this is an example of a resolution that the Saginaw Chippewa Indian Tribe passed, just recognizing Breastfeeding Awareness Month. It supports education and sort of increases people's understanding about the value of breastfeeding, includes language linking breastfeeding to the tribe's traditions and culture, and expresses the tribe's commitment to supporting it. And again, so this kind of policy is very helpful for supporting program work, which in turn then leads to more policy, things like a workplace breastfeeding policy, or a policy, a right to breastfeed kind of law for the community. And and I'm sorry if I feel like I'm spending a lot of time on this, but this is an area we get a lot of questions. So, and I will get also, like Erin, these slides will be available to the conference website and to folks, so you don't have to feel like you got to try to capture all this. But here's just some concrete ways that if you're doing program work and you're trying to think about how do I, what kind of policy can I use to build off that work, here are some examples of the two kind of things side by side. So I know this conference is a nutrition conference, but as we've been hearing during the past 2 days and continue to hear, food sovereignty is such a big part of ensuring that there is going to be nutritious foods available, and that and we've had many, many stories and examples of how re-indigenizing our foods is a fundamental strategy or way of improving health for tribal and urban Indian indigenous communities. And of course, policy plays a part here. And so this is an example that I like to highlight. It is from a food sovereignty strategic plan from the Blackfeet Nation and Blackfoot Confederacy, and we've heard from people from that nation, some of it touching on this type of work. It was also talked about at the 2019 conference. But it's such a beautiful plan, and it's so, I think, helpful, and it lays out, in that middle image, you can see it lays out that full concept, which centers and connects culture with traditional foods, health and well-being, agriculture, and the food and land access. And so all of these 5 categories, or 4 categories, are connected, and then connected to 5 categories of strategies. And then the strategies also, the strategic plan has 4 main pillars, which are shown by the circle that I think is on the left. And you'll see that policy is one of the pillars, along with youth engagement, self-sufficiency, and partnerships. But you can see also, if you look more closely at the other pillar sections, you'll see that policy is embedded in all of those things and is certainly relevant to the pillars. As you can, and that community and partner engagement is part of all of them as well as programs. So all of these things are really just working together. And this reminds me that that I brought this up here because it was in our folders, and I really want to encourage you to take a look at it if you haven't already, because one, it's a beautiful publication, but this is about the 2019 conference, and there is a section here about effective tribal nutrition policies, and that was presented on at that conference. And so someone talked about work relating to this plan, and then there were many really good examples too, so I hope you'll take a look at that for some ideas. And then now I'm going to take a short detour into some policy writing basics, and I promise we're not going to talk about this too much. But for those of you who haven't worked a lot with written policies, I wanted to demystify that a little bit, because I think sometimes people think, oh, policy is like, it's so complicated and difficult, and I don't really want to like mess with it. But it isn't really that hard. I mean, not in terms of just like how you write it, because most policies have this kind of basic structure. And once you know this, I'm not going to say that writing a policy is easy, because it isn't easy. But the challenge is not actually in like writing down these different parts. It's more in making sure that you have a policy that will work for your community. And once you have that, writing it down is really, in some ways, some of the easier part of it. And so normally I would do it when I do a training about policy development. I'd kind of walk people through all these different sections, the findings, the purpose, the definitions, the restrictions, requirements, the enforcement section, and severability, and go through examples. But I just wanted to give you kind of a high-level snapshot of what these sections are, and I will talk just a little bit about a couple of things. So like in the findings section, if you remember, it said like that's part of where you're telling the story about what is behind this law, or policy, why do we need it, why is it important, I like to share this example from the Little River Band of Ottawa Indians. This is from their conservation code as part of the findings section, because it tells a story in such a beautiful and culturally relevant way, including integrating language as well as cultural concepts. It talks about how conservation is an integral part of the tribe's history and present, that it's woven into the fabric of its governance. It also draws clear connections to the importance of maintaining the tribe's traditional food system for both nutrition and spiritual health. So it's a very powerful example and shows that even when you're using a Western concept like a written set of codes or policies, tribes can claim and reframe that for themselves and make sure that it's truly representing their community. Here's another set of examples of findings from a healthy food policy. So this is like a policy. This is kind of drawn from a couple of different examples of tribal organizations' policies. So these are not laws, but these are findings that were included that the organization wanted to explain why we are having this healthy food policy, or a policy about why we're going to prioritize and feature healthy foods at our meetings, and also try to reduce waste, so like using compostable paper products and things like that for when we're serving food at meetings, or why we're cutting back on sugary drinks and wanting to highlight things like indigenous teas and water and other healthier beverages. And so these are just, again, some kinds of ways to talk about these things that will hopefully resonate with people in your community or people within your organization. And then when we talk about policy development, and I think as many of you know, and from what I've seen, many of you are doing this work already in a very natural way. And again, probably because nutrition policy or food policy is so connected with our cultures and our emotions and our daily lives. And so it really requires meeting people where they are at, and making sure you're building buy-in from both the grassroots as well as your grass tops, or those policymakers or government officials who are going to be carrying out that policy or deciding on it. And as well as like navigating things like food safety laws or pushing on federal policy to live up to the U.S. trust obligation. So like all of these things require a reiterative process. But this is a framework, like sort of looking at this process from our perspective, from the kind of a higher level. I've taken some of the lessons and things that I've seen from this kind of community-driven policy work to develop this framework that we use to help people think about the process of developing a policy and how to make sure that you're really centering the needs, the priorities, and the values of your community within that process. And so we try to really, in this framework, we try to really surface that piece of it. And so this framework we developed has 6 stages. The research, evidence, and expertise stage, where you're pulling together information to inform that policy, figuring out what your solutions are, what kind of policy you're going to look for, then getting to the work of writing it down and drafting it, advocating for it, and then implementing it, educating people about it, rolling it out, and then making sure it's being followed and figuring out if it's working the way it's supposed to be, the enforcement and evaluation piece. So those are the 6 general phases. They don't necessarily go in this order. I just, there is sort of an order to them, but I have found that this kind of policy work is really, like we say, reiterative. You kind of go back and forth between the stages. You're always collecting information. You're always advocating. So please don't think about it as like you just boom, 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 boom through this. But these are the stages. And again, I go back to Chef Kayan's story, and she really, her experience in working in that policy for the university food system really tracked with this, because she talked about having that policy, collecting all this information, understanding the university, understanding the importance of having indigenous foods in the cafeteria for indigenous students, but also for the whole population, and then figuring out how to make that happen, getting it written down, and then kind of doing all the conversations, having the champion, working with the gatekeepers to getting it to work, rolling it out, figuring out how to make the produce from the garden accessible, all of these things to make sure that that policy could become a real thing. And then this is another framework I wanted to provide for you because I thought it's a really useful one, and it was developed by the Chunli Coalition at the Cheyenne River Sioux Tribe at Missouri and Missouri Breaks. And again, it has many of the same pieces that you saw kind of written in the list that we have, but presented again, perhaps in a more organic way. And it really shows how community engagement is at the core of policy development work, but also how it is encompassed in other pieces of the work, and showing how cultural lifeways inform all parts of it too, both the policy development as well as the education or the programmatic part of rolling the policy out. All right, so in the this last part here is where I'm really going to talk about just some specific policy ideas. And again, some of the examples that are listed here are ones that were also talked about at the 2019 conference. That's the Food Sovereignty Strategic Plan from Blackfeet, a tribal fish processing code, working with tribal zoning laws to address issues around leasing, so that land could be used for agricultural purposes. Then the Indigenous Food and Agriculture Initiative's Model Tribal Food and Agriculture Code is an amazing comprehensive resource for ideas about food policy for tribes. And then Stacy Hammer, who was one of the conference organizers and works with the Lower Sioux Indian community, she was part of a group at Lower Sioux who adopted a very comprehensive policy called the Honoring Little Crow Healthy and Indigenous Foods Resolutions. That's a screenshot there of the cover page, which really was talking about making healthy food available across the tribe in a very comprehensive way. And then there's more ideas. Of course, like IFAI has a lot of resources to support the development of a tribal agriculture department. We talked a little bit about a Veggie RX program. I know that's an area too where a lot more tribes are interested. Navajo has one, and some tribes in the Great Lakes area, several tribes are running them. Bay Mills participates in one. So that's another type of policy. So there are many ways to approach this work, I think, as many of you know. I want to spend a little bit of time talking about this policy example because it builds off the IFAI's Model Food and Agriculture Code, but it also is about indigenous foods and making healthy foods more available both for economic health as well as for personal health. And so this is something that Connie Watson, who's the she's also here today, sitting over here. Yes, thank you, Connie. And her Let's Eat Good Food Coalition worked on, and so through their Good Health and Wellness in Indian Country work. And so Connie, as the market manager for the Bay Mills Indian Community Farmers Market, which is one of the biggest and most robust farmers market in that the UP area in Michigan, saw a need that they had community members who wanted to make foods that are processed through traditional means. They wanted to be able to sell those at the farmers market, but they were not foods that there was some question as to whether they would qualify under Michigan's food safety law for being sold at a market. And even though Michigan state law doesn't apply on the reservation, there was just concern about causing friction with state regulators, and getting people into trouble if the food were to move across the border and these kinds of things. So in order to address this kind of need and this gap, Connie and the coalition decided to work on a cottage food law for the tribe. And so this is what was the result of this. And so this is a law that allows tribal members to create foods through, again, traditional means that have been recognized as safe historically through hundreds of years of practice, and as long as they're properly labeled and the vendor is registered, they can be sold there. And so I just wanted to highlight some pieces of that law. So in the previous slide, I had the purpose section. Here you're seeing some of the definitions, how they approach defining what is a culturally significant food, what does it mean to be prepared in a traditionally safe manner. So, again, these were just things that they just had to kind of spell it out a little bit so they could put it into this law. And then here are the kind of the core of the law that's talking about what can be sold, that food that is culturally significant and prepared or prepared in a traditionally safe manner. And then there was more about labeling requirements, which I don't have on the slide. I wanted to point out there was a little bit of an exemption here, again, for people, for nonprofits that are selling food, things to raise funds for charitable purposes. They're not required to register and follow this. So that one small exemption. And then here's what it says about enforcement. So that the license can be revoked if the vendor doesn't follow. But I mean, this law has been on the books since 2019. I know we had COVID and that has impacted a lot of things. But in talking to Connie, it sounds like things have been going all right. Vendors have been following it, and they've been allowed to sell some things then in the farmers market that the market wasn't able to offer before. These are just a few more. So that's just a very short sort of story about one example of kind of an innovative way to use sort of a Western policy idea, but make it work for a tribe. And then here are some more resources for doing more of this kind of work. Great Lakes Indian Fish and Wildlife Commission has a great model food safety code for processing foods that are hunted or gathered. So there's a link to that, and then some more IFAI's tribal ag department stuff, and then a guide from the Northwest Portland Area Indian Health Board about tribal policy in general. I want to just let you know that we're coming out with a toolkit to support first food policy or breastfeeding or support policies. I hoped it was going to be done by this conference, but it actually will be out in June. It'll be coming up on our website. It's building off of our work looking at with Great Lakes with the Great Lakes Indian Tribal Epicenter, looking at tribal policies for support breastfeeding across the Great Lakes region. And then we have this resource about drafting laws and tribal laws and policies in general on our website, and that's my contact information. So thank you, everybody. Thank you very much. And I am out of time, so I don't know if we have time for questions, but I really appreciate the opportunity to be here and speak with you all today. Miigwech.